Did the Trump administration just try to build a medical facility in Kenya? Let's talk about it. Donald Trump and his administration have the audacity to try and build a medical facility in Kenya. Now, this man sits around and talk about how nasty every other country is. And you're trying to build a medical facility in Kenya to treat American citizens so he can quarantine the American citizens that catches Ebola over in Kenya instead of having them come and infect America. So we're going to go over there and infect Kenya instead of coming home and getting treated here. This man has lost his damn mind. Take a look at this clip.
The number one priority of our foreign policy is to protect the American people. We cannot and will not allow any cases of Ebola to enter the United States.
Kenya said no. I wasn't expecting this Ebola news, but I'm Dr. Frida, and a high court in Kenya said no. They have blocked the United States plans to build a facility for United States citizens infected with or exposed to Ebola in Kenya. Yes, for this current Ebola outbreak, the United States has a plan that instead of repatriating United States citizens who are exposed to or infected with Ebola, we have decided to build a facility in Kenya that can treat 50 patients. And so instead of patients coming here to the United States, where we actually have the best, arguably, facilities with the proper containment and the highest level of treatment, we've decided to send our United States citizens to Kenya. Well, the High Court in Kenya said that this would cause imminent danger because as of now, Friday, May 29th, there are 0 cases in Kenya. And so the United States plans were to send infected citizens to Kenya so that we keep them out of the United States. So some law groups in Kenya and a medical union, the KMPDU, have petitioned against it. In fact, one of the representatives of the medical union said that if Ebola is too dangerous for America, it's too dangerous for Kenya. That union representative stated that Kenya will not become a containment colony for a lethal pathogen that was not generated in Kenya. And now there are questions. Why is it that the United States thought that Kenya, with 0 cases of Ebola, should be exposed while the United States is not exposed?
I didn't say shit, all you did.
The other argument from some officials in Kenya is that Kenya already has a strained healthcare system. And the question is, if the U.S. is permitted to have this quarantine unit in Kenya built for United States citizens, if Kenyans then get infected with Ebola, will they be permitted to be cared for at the facility? That's not clear. Remember, this rare Bundibugyo Ebola strain still has no vaccine, no approved treatments, and it is spreading like wildfire, quite frankly. Question: do you think that it is proper for the United States to send United States citizens to Kenya to be cared for as opposed to repatriating them to the United States? Why do you think the government thinks it's okay to send these patients to Kenya? Please comment. Share this video and make sure you watch my other videos on the Ebola outbreak.
You damn right. Kenya said no. As the video states, no one's gonna let you basically come and dump your mess in their country and infect their country when their healthcare system is not even as good as ours. And then on top of that, if I were to catch Ebola, I would want to be in my own country where my family is. This man has a lot of nerves. Drop down in the comments how you feel about Donald Trump and this administration trying to ship off Americans to Kenya just because they're infected. Go figure. I thought that wasn't something that we had to worry about. Once again, Donald Trump and his administration never fails. Like, share, and follow me for more controversial topics.